Okay, hello all, and welcome to our new George Institute for Global Health podcast series on women's wellbeing. In this series, we're going to examine, with the help of colleagues at the University of New South Wales Women's Wellbeing Academy and beyond, a broad range of topics on issues that affect women's wellbeing, including but not limited to medical illness. My name's Amanda Henry. I'm the Program Head of Women's Health Program at the George Institute for Global Health, Professor of Obstetrics at UNSW, and an obstetrician at St George Public Hospital in Sydney, Australia. And I'll be the host for these podcasts. Since this is the first in a new series, I will briefly introduce our Women's Health Program in a minute for context. However, first, I would like to acknowledge we're recording on the traditional unceded lands of the Gadigal people of the Eora Nation and pay my respects to elders past and present. I'd also particularly like to extend that respect to any First Nations peoples who are listening into the podcast. And now, regarding our women's health program at the George Institute, we aim to improve the health of millions of women and girls worldwide through better care and better treatments for the major issues that affect us all, and through building healthier societies. The pillars of our program include achieving equity in sex and gender in research, health and medicine, using pregnancy to improve women's lifelong health, improving outcomes for women-specific conditions globally, addressing the impact of climate change on women's health, and also ensuring that artificial intelligence and digital medicine is used to improve women's health, not further exacerbate existing inequities. Okay, so for this first podcast, it's my very great pleasure to chat with Professor Bronwyn Graham, who's the Director of the National Centre for Sex and Gender Equity in Health and Medicine, which is a collaboration between the George Institute for Global Health, University of New South Wales and Deakin University, established last year to drive sex and gender integration in Australian health and medical research and policy and healthcare delivery. As well as leading the centre, Bronwyn's also Professor of Psychology at UNSW Science and a global expert in women's mental health. I may get back to Bronwyn another time to talk more about her personal research.
Thanks, Amanda. Great to be here.
However, today we're going to unpack a bit about sex and gender and its importance to women's wellbeing and indeed to all of us. So, Bronwyn, starting with basic but often misunderstood question and answers. What are sex and gender?
A very good place to start, Amanda. And you're right, the two terms are often conflated. So let's get that clear. The first is sex, and that refers to a set of biological characteristics. So here we're talking about chromosomes, we're talking about hormones, we're talking about sex organs and genitals. Now, gender is a socio-cultural construct, and it refers to how people identify, what their experiences are. It refers to gender norms in society. It is fluid, it changes over time, and although gender often aligns with one's sex, it does not always align with one's sex.
And there's been a lot of buzz around lately about, how many sexes and genders it's kind of possible to have. Can you just sort of unpack what we would say, the terms we would use in terms of biological sex, and then the various sort of terms across the gender continuum as well?
Absolutely. So sex is typically classified as male or female, and it's defined according to those sex characteristics that I outlined. But it is important to note that a small percentage of the population are born with natural variations in those sex characteristics, which means that they don't actually fit into the medical norms for male or female bodies. And so these group of people we refer to as intersex, or people with variations in sex characteristics. In contrast, gender is a much more, as I said, fluid term. We talk about men and women and boys and girls when we talk about gender, but of course people can also be non-binary, they can be gender fluid, or a whole other range of gender diverse experiences.
Okay, so Bronwyn, following on from what we mean when we're talking about sex and gender, why does it matter? Why are sex and gender important to health and medicine?
So sex and gender impact almost every single health condition, irrespective of whether that health condition presents only in males or only in females or both. So let me give you a couple of examples to show what I mean. Let's take asthma. So there are well-established sex differences in asthma prevalence. When males are young, they are more likely to have asthma than females. And this is due to sex differences in the development of the lungs. But post-puberty, the prevalence flips and females are more likely to have asthma than males. And this is because, in part, of the onset of hormonal fluctuations associated with the menstrual cycle. But there are also gender impacts on asthma risk due to differences in environmental exposures. So women are more likely to be exposed to chemicals through environments like hair salons, nail salons, or occupations like cleaning. So you see here there's both sex and gender impacts on asthma. Let me give you another example. Mental health. We know that almost all mental health conditions are more prevalent in women than in men. And that is in part due to gender effects. So things like women's greater exposure to certain stresses and traumas, intimate partner violence, but also due to mental health stigma experienced particularly by men. So men are not coming forward and they're being underdiagnosed because of that hesitation in coming forward to getting help. But there's also sex effects on mental health. So we know that with fluctuations in the menstrual cycle, women's symptoms of anxiety, depression, even schizophrenia change. So they become more severe during periods of lower sex hormones. And in addition, the risk of mental health changes over the lifespan coincident with hormonal fluctuations in females. So things like perimenopause, perinatally, and again, across the menstrual cycle. So again, both sex and gender impacts on a condition.
Mm-hmm. Okay. So historically, how have we been at adequately considering sex and gender in our medical research and practice?
Not great. So historically, we have assumed that there are no meaningful sex or gender differences. And moreover, we have assumed that we can study basic biology, basic health conditions in males and have those findings apply to the rest of the population. So even today, the vast majority of preclinical research, so that's research conducted in cells or non-human animals, is only conducted in males. And then when we look at clinical trials, today we have better equivalence in terms of male and female participation in clinical trials. Historically, not so great. Again, it was typically males that were participating in clinical trials. And so the assumption was that that's okay because there's no meaningful differences apart from reproduction. And so we can just transfer what we know about males to females, intersex people, trans, non-binary, and so forth.
Right. So we've fallen into the default human is male trap, and sort of everything can be extrapolated from there.
Exactly. Yes.
Mm-hmm. Okay. So what do we need to do to rectify that situation, and why?
Yeah, well, I'll start with the why first. And the reason that we need to rectify that is that there's been a lot of documented detrimental outcomes as a result of that assumption that we can just focus on the male and ignore sex or gender specific influences on health. So we know, for instance, that women are twice as likely to develop adverse reactions to drugs and vaccines than are men. We know very little about how to treat various health conditions that appear in people with variations in sex characteristics or trans people, because we're simply not collecting data in these populations. We know that women are 9 out of 10 of the cases of chronic pain. Yet the vast majority of research on pain and how to treat pain has been done in males. And we know that pain medications and anesthetics are not as effective in women as they are in men. And so essentially what is happening is that um, that the health that treatments for women and for trans and gender diverse people and people with variations in sex characteristics are essentially less evidence based than they are for men. And so we need to resolve that to make sure that everybody has access to evidence based healthcare that is fit for purpose for their bodies. So what is being done to change that? Well, around the world, policies have been introduced to require researchers who are doing biomedical research to take sex and gender into account at all stages of the research, from the question setting through to the data collection, through to the reporting of the data and the implementation of that data into healthcare treatments. So Canada was really leading the charge here. They've had policies for going on about 15 years. The US and Europe have followed with their own policies. Here in Australia, we are a little bit behind what is happening internationally, but very encouragingly, last year, the National Health and Medical Research Council, so that's Australia's prime funding body for health and medical research, has released their own statement on sex, gender, variations in sex characteristics and sexual orientation, which is strongly encouraging all Australian researchers to take these variables into account.
Okay. And beyond sort of the NH and MRC statement, I guess I've got two questions. Probably one is, how do we actually implement that? You know, what do we need to do to make sure that it's not just fancy words, and that it leads to better health and research outcomes for women and indeed everyone. Then my other part of the question, I guess, is about beyond research practice, what we need to do in terms of education and really, embedding some understanding.
So internationally, it's very clear that policies alone are completely ineffective in shifting practices. And those policies, to be implemented effectively, they have to be measured and they have to be assessed. So in Canada and in the US, in the grant application, researchers are required to say how they have accounted for sex and gender. And they receive a score that says how well they did at accounting for this. And so researchers, they do what they can to get their research funded. And so if something like that is in the funding application process, that's going to be a very effective means of changing practices, because it puts some teeth into the policy. And so...
And sorry, I'm just going to jump in there because I was wondering, do we have any evidence that then also leads to better outcomes? Like for countries like Canada, who are that much further ahead of us, do we now have examples of how that funding with teeth has actually led to better quality, outcomes and for the population?
And I'm so glad you asked that, because yes, we do have that evidence. So Canada have now been able to look back at the applications and the scores of the applications over the years of this policy implementation. And what they found is that the grants that are judged to take sex and gender into account well are also the grant applications that are scoring at a higher quality on all the other aspects of that application process. So what this means is that research that takes sex and gender into account tends to be better research. It's more comprehensive, it's better considered, and that's reflected in the funding scores. So it really provides an incentive, I think, for researchers and for funding agencies alike, that this is something that, aside from equity, which of course is great, we want to make sure that everybody benefits from research, it's actually improving scientific rigor and reproducibility.
So we're not ticking a box, we're actually doing something fundamental to improving the quality of our science and therefore hopefully the flow-on effects to our populations.
Absolutely, because when you start digging at the mechanisms underlying different health conditions and treatments, you always get to sex or gender, right, at the end. It's a fundamental part of a mechanistic understanding of health and disease. And so science and research that takes that into account is just better, more comprehensive science.
Mm-hmm. And then back to my other question about education. How do we, get this in from the ground up so that I guess it's not a continual kind of surprise that sex and gender exists and is important, and a need to rediscover every 5 years.
Yeah, so we absolutely have to change the core competencies for medical students and indeed for all health professionals, such that sex and gender literacy, in terms of understanding what these terms are, but also how they impact different health conditions, becomes a core competency across the board. So this is not a specialized area. This is not niche. This is something that needs to be understood for every health condition and every health profession. And so that really comes back to the higher education curricula, doing a comprehensive survey of how well it's being taught currently, which, I think anecdotally we probably all appreciate that it's patchy at best. But then again, change the policies, change the competencies that people are required to learn.
Okay. Bronwyn, thank you so much. Any last kind of take-home messages or wish lists for us in the very fundamental area of sex and gender in health?
I think it really goes back to what I was saying earlier, that there's a lot of rhetoric around sex and gender at the moment. It's a bit of a hot button topic, but I would encourage everybody to go out and do their own reading on it to understand just how fundamental these characteristics are to our health and well-being, and appreciate this idea that actually at the end of the day, this is just about improving scientific rigor and improving best practice quality healthcare, and that everybody stands to benefit from this. It is not just women. It is not just sex and gender minorities. Men, of course, have sex and gender, and understanding how male-specific characteristics impact health is also going to improve health outcomes for men too.
Excellent. Thank you.
Thanks, Amanda.